Hi guys and welcome back to EverlastCyber. We'll be going through the part 5 of the NACC PSW 2025 practice questions and answers, and we'll be starting right off with question 1. What is tachycardia? A. Slow coughing. B. Rapid heart rates. C. Rapid breathing. D. Slow heart rates. Let's look through the options we have. In option A, slow coughing is totally unrelated to heart rhythm. Coughing is a reflex of the respiratory system and it's usually caused by irritation in the throat or the lungs, but this is not a heart condition. In option B, tachycardia literally means rapid heart rate. And this is usually defined as a heart rate that is above 100 beats per minute in adults. It is a medical condition where the heart beats faster than normal. In option C, rapid breathing is not tachycardia, rather, it is called tachypnea. It is an abnormally fast respiratory rate, and it's usually seen with fever, anxiety, lung disease, or heart failure. In option D, slow heart rate is actually the opposite of tachycardia. Slow heart rate is called bradycardia. It means that it means that an adult has a resting heart rate that is below 60 beats per minute. This can be normal in athletes, but it's concerning if it causes dizziness or fainting. So, based on the question we have, the correct answer is option B. Tachycardia is a rapid heart rate and it is a medical condition where the resting heart rate is over 100 beats per minute in adults. Question 2. What does the suffix itis mean? A. Inflammation. B. A condition. C. Paralysis. D. Pain. For this, the correct answer is option A. Itis means inflammation. So, some examples of inflammation are like arthritis. Arthritis is an inflammation of a joint. Tonsillitis is an inflammation of the tonsils. And bronchitis is an inflammation of the bronchi. Option B, this would not be the correct answer because the suffix for condition is usually osis. For instance, tuberculosis or neurosis, that is the suffix for a condition. In option C, that is also incorrect because the suffix for paralysis is plegia. So, for instance, hemiplegia, this is the paralysis of one side of the body. So, that is not the correct answer. And in option D, the suffix for pain is algia. For instance, neuralgia, which is known as nerve pain. So, based on the options we have, the correct answer is option A. Itis means inflammation. Question 3. Residence is a term used to describe a person who is receiving care at A. Home, B. A long-term care facility, C. An outpatient clinic, D. A hospital. In option A, a person that receives care at home is usually called a client or sometimes a home care patient, but that person is not referred to as a resident. In option B, in nursing homes or assisted living facilities, the people live there and receive daily care. Therefore, they are referred to as residents because they reside in those nursing homes or assisted living facilities. In option C, people visiting an outpatient clinic for treatment are called patients, not residents, because they do not live there. And in option D, people admitted to a hospital are also called patients and not residents. So, based on the options we have, the correct answer is option B. In nursing homes or assisted living facilities, the people who live there are usually referred to as residents. Question 4. When assisting a client with a bedpan, the support worker should A. Protect the bed and linen by placing waterproof pad under the bedpan. B. Rinse the bedpan rim under cold running water before use. C. Dust the bedpan rim with powder to prevent sticking. D. All of the above. Now let's look at the options. When helping a client to use a bedpan, the standard safe practice is to protect the bed linens, and this is done by placing a waterproof pad, that is an incontinence pad or a soaker pad. Place it under the client before positioning the bedpan so that they don't soil the bedding. This will keep the bedding clean and dry in the event that there's any spillage. In option B, rinsing the rim with cold water is not required because the bedpans are cleaned properly between uses. So you wouldn't have to rinse the rim with cold water immediately before placing it. And in option C, dusting with powder is not recommended because powders can cause skin irritation and inhalation risks. So this is not the best practice, especially for infection control. D would not be the correct answer because we have just one correct answer from the options, and that answer is option A. The support worker should protect the bed and linen by placing waterproof pad under the bedpan. Question 5. Which of the following is required to help a client give informed consent? A. Asking the client politely to hurry up and make a decision. B. Ignoring details about the potential risks and side effects of the treatment. C. Reassurance that the proposed treatment is the only option. D. Information about the likely consequences of not having the treatment. Option A is wrong because informed consent must be voluntary and never rushed. The clients need time to understand their options before they decide on the course of action to take. The same thing goes for option B. Full disclosure of risks, benefits, and side effects is essential for true informed consent. In option C, that is also incorrect because informed consent requires providing all reasonable options and not pressuring the client into one choice. So, for consent to be informed, the clients must understand what could happen with and without the treatment, including the risks, benefits, and alternatives. So, our answer here is option D. Question 6. Mr. Mohammed's photograph is made public on the internet without his consent. This is A. Battery. B. Invasion of privacy. C. Libel. D. Unintentional tort. Battery is when someone uses physical force or harmful touching without consent. So, for instance, hitting a patient or restraining that patient. In option B, invasion of privacy occurs when someone's personal information, image, or private matters are exposed without their permission. So, in the scenario we have here, Mr. Mohammed's photograph was posted online without his consent. So, this is a clear example of invasion of privacy. Libel means publishing false written statements that damages a person's reputation. But sharing a photo without permission is not libel unless it is used in a defamatory context. An unintentional tort is harm that is caused by accident or negligence, for instance, a medical error. But this is not the case we have here. Based on the scenario, the answer is option B. Invasion of privacy occurs when someone's personal information, image, or private matters are exposed without permission. Question 7. Who decides the kind of recreation activities a long-term care client will do? A. The client's family. B. The client's physician or nurse. C. The facility. D. The client. The client's family can give input or suggestions, but they do not make the final decision. The client's wishes always comes first. Additionally, healthcare professionals may recommend safe activities, but they do not get to decide for the client unless the client is medically unable to decide for themselves. The facility organizes and offers recreation programs, but the clients are not forced to participate. The choice belongs to the client. So our answer here is option D. In long-term care, the residents have the right to choose the activities that interest them, and this is part of respecting their independence and dignity. Question 8. Informed consent is obtained by the A. Client's family, B. Registered staff, C. Client's substitute decision maker, D. Support worker. Family members do not automatically provide informed consent unless they are legally designated as the substitute decision maker. For option B, informed consent must be obtained by the healthcare professional such as a physician, a nurse practitioner, or a registered nurse, and this is the person that is performing or is responsible for the client's treatment. They must explain the risks, benefits, alternatives, and consequences before the client agrees. In option C, the substitute decision maker can give consent on behalf of the client, but that is if the client is unable to do so. However, they don't obtain it. Consent is obtained by the registered staff and then given by the client or the substitute decision maker. In option D, support workers may reinforce information or witness signatures, but they do not obtain informed consent. So our answer here is option A. Informed consent is obtained by the registered staff who is responsible for performing the treatment on the client. Question 9. The basic rules about wages, work hours, and vacation days are covered in A. Labor relations legislation, B. Workers' compensation legislation, C. Employment standards legislation, D. Regulated health professions legislation. Option A, the labor relations legislation deals with the relationship between employers, unions, and employees, but it does not set the basic rules for wages or vacation days. Workers' compensation legislation focuses on the benefits and support for workers who are injured or become ill because of their job. But this is not about wages, hours, or vacation. The employment standards legislation sets out the minimum rules for employment, such as the minimum wage, maximum work hours, public holidays, overtime pay, and vacation days and their pay. It also ensures fair treatment of workers. The regulated health professions legislation covers licensing, standards of practice, and regulation of healthcare professionals, but it doesn't necessarily focus on the workplace conditions. So, based on this option, the answer is option C. The employment standards sets out the minimum rules for employment and ensures fair treatment of workers. Question 10. The illegal restraint of a person's movement is A. Assault, B. Battery, C. False imprisonment, D. Defamation. Assault is threatening or attempting to cause harm, making someone fear that they will be hurt. Battery is the actual physical contact or harmful touching without consent. For instance, hitting, slapping, or restraining someone by force. False imprisonment is the illegal restraint or restriction of a person's movement without their consent or legal justification. An example is locking a patient in a room, using restraints without a doctor's order, or preventing someone from leaving a facility. That is false imprisonment. Defamation is damaging someone's reputation by making false statements. So this is like the spoken word, like slander. But if it is written, it is libel. Based on the question we have, the correct answer is option C. False imprisonment is the illegal restraint of a person's movements. For instance, locking a patient in a room, using restraints on the patient without a doctor's order, or preventing the patient or clients from leaving a facility. Question 11. Who decides how to style a client's hair? A. The client. B. The nurse. C. The support worker. D. The family. For this, we'll be going with option A. The clients have the right to make decisions about their personal appearance, including how they want their hair to be styled. This respects their autonomy and dignity. Question 12. What are changes in psychological and social functioning called? A. Growth. B. A stage. C. A reflex. D. Development. Growth refers to physical changes in the body, such as increase in height, weight, or organ size. A stage is a specific period in a person's life, such as adolescence, adulthood, but it doesn't describe the overall changes themselves. A reflex is an automatic, involuntary response to a stimulus, but it is not a change in functioning. Development, on the other hand, refers to the changes in psychological, emotional, social, and cognitive functioning over time. So our answer here is option D. Some examples of development are forming relationships, learning to communicate, or developing problem-solving skills. So this is the changes in psychological and social functioning. Question 13. How should the support worker respond when dealing with an agitated person? A. Stand as close to the person as possible. B. Talk to the person loudly in a firm manner. C. Touch the person to calm them. D. Move close to the door. In option A, being too close to the person can feel threatening and may even increase agitation. So it is wise to maintain a safe distance. In option B, yelling or speaking too firmly can escalate the situation. It is advised to use a calm, gentle, and reassuring communication. In option C, physical contact can be misinterpreted or trigger aggression. Only touch the person if the person consents and if it is safe. In this case, the best advice is to position yourself near the exit to ensure your personal safety while still being able to communicate calmly and assist the person. So our answer here is option D. Move close to the door. Question 14. Which of the following measures will best promote sleep? A. Following bedtime rituals. B. Drinking alcoholic beverages at bedtime. C. Exercising vigorously just prior to bedtime. D. Doing a leisure activity like playing a video game. For this, we'll be going with option A. Establishing a consistent bedtime routine, such as reading, taking a warm bath, or listening to calming music, helps to signal the body that it is time to sleep, and this promotes a better sleep quality. Alcohol may initially make someone drowsy, however, it disrupts the sleep cycles and it reduces the overall sleep quality. Vigorous exercise close to bedtime can increase the heart rate and alertness, and it will make it harder to fall asleep. The same thing goes for playing a video game. So, video games or screen time before bed stimulates the brain and exposes the eyes to blue light, and this can delay sleep onsets. So, the correct answer is um, following a bedtime ritual. So, it depends on what it is for an individual. Some individuals, their bedtime rituals includes reading, taking a warm bath, or listening to calming music. So that is the best thing to do to help promote sleep. Question 15. Heat applications are used for all of the following except to A. Relieve pain, B. Control bleeding, C. Decrease joint stiffness, D. Relax muscles. For option A, heat helps to increase the blood flow and relax tissues, and this can reduce pain. Heat, however, does not control bleeding. In fact, it may increase bleeding because of the dilation of the blood vessels. It is advised to use cold applications to control bleeding and reduce swelling. Heat relaxes muscles and soft tissues, thereby improving flexibility and reducing stiffness. And heat applications also helps to reduce muscle tension and promote relaxation. So out of those options, the one that heat application is not used for is option B, to control bleeding. Heat does not control bleeding. Instead, it may increase the bleeding because of dilation of the blood vessels. Question 16. As a patient, Mrs. Blaze has the right to A. Considerate and respectful care, B. Information about her diagnosis, treatment, and prognosis, C. Refuse treatment, D. All of the above. For this, we'll be going with option D. So, patients have the right to be treated with dignity, respect, and compassion. They also have the right to understand their health condition, their treatment options, and the likely outcomes in order to make informed decisions. Patients also have the right to accept or refuse any treatment as long as they are competent and informed about the consequences. So, a patient's right includes all these aspects, thereby ensuring autonomy, informed decision making, and respectful care. Question 17. Which of the following is true about do not resuscitate orders? A. If a client is not mentally able to make the decision, the nurse does. B. They are ordered for clients who are not expected to recover. C. Family can never make this decision. D. They can be written by the nurse or doctor. In option A, nurses cannot make DNR decision. It is only the physician or the client's legally authorized substitute decision maker that can do this. DNR orders are written for clients with serious life-limiting conditions where resuscitation would not improve their quality of life or outcome. In option C, if the client cannot make the decision, a legally authorized family member or the substitute decision maker may make it on behalf of the client, but they have to also be following the client's wishes. In option D, only a physician or authorized healthcare provider can write a DNR order. A DNR order is never written by a nurse. So our answer here is option B. Question 18. An infection acquired after admission to a healthcare agency is A. Communicable disease, B. Hepatitis infection, C. Healthcare associated infection, D. Viral infection. A communicable disease can spread from one person to another. However, it doesn't specifically refer to infections that are acquired in a healthcare setting. In option B, hepatitis is a specific viral infection of the liver, and while it can be healthcare associated, the term is too specific. In option C, healthcare associated infections are infections that a patient acquires after being admitted to a hospital or a healthcare facility. These infections were not present or incubating at the time of admission. For instance, urinary tract infections from catheters, surgical site infections, or even pneumonia from ventilators. In option D, viral infection refers to the type of pathogen, but it doesn't say where or how it was acquired. So the best answer for this question is option C. the healthcare associated infection, is an infection that is acquired after admission to a healthcare agency. Question 19. Shortened forms of words or phrases are A. Word elements, B. Abbreviations, C. Suffixes, D. Medical terms. For this, we'll be going with option B. Abbreviations are shortened forms of words or phrases. For instance, BP is an abbreviation of blood pressure, RX is an abbreviation for prescription, and HR is an abbreviation for heart rate. Question 20. The person or population that comes in contact with a pathogen is called the A. Vector, B. Pathogen, C. Host, D. Vehicle. A vector is a living organism like a mosquito or a tick that transmits a pathogen from one host to another. A pathogen is the disease-causing organism itself, such as a bacteria or a virus. A host is the person or population that becomes infected or comes in contact with that pathogen. So, for instance, if someone is bitten by a mosquito carrying malaria, that person is the host. A vehicle is a non-living source that transmits a pathogen, for instance, contaminated water, food, or instruments. So for this question, a person or population that comes in contact with a pathogen is called a host, and that is option C. Question 20. Which part of the brain is largest and contains the center of thought and intelligence? A. Cerebellum, B. Cerebrum, C. Midbrain, D. Brain stem. The cerebellum is smaller than the cerebrum and is responsible for balance, posture, and coordination of voluntary movements. The cerebrum, on the other hand, is the largest part of the brain and it contains the centers of thought, intelligence, memory, reasoning, and voluntary movements. The midbrain is part of the brain stem and it controls functions like vision, hearing, and motor control, while the brain stem controls the basic life functions such as breathing, heart rate, and blood pressure. So out of these options, the answer is option B. The cerebrum is the largest part of the brain and it contains the centers for thoughts, intelligence, memory, reasoning, and voluntary movements. Question 22. The canal that leads to the primary internal female reproductive organs is the A. Vagina, B. Perineum, C. Urethra, D. Clitoris. The vagina is a muscular canal that leads from the external genitalia to the uterus, and this is the primary internal female reproductive organ. The perineum is the area between the vagina and the anus. The urethra is a tube that carries urine from the bladder to the outside of the body, while the clitoris is an external erectile organ that is involved in sexual arousal but not reproduction. So our answer here is option A, the vagina. Question 23. A cataract is an eye disorder in which A. The optic nerve is damaged, B. The lens becomes cloudy, C. Pressure within the eye is increased, D. Severe eye pain is common. In option A, when an optic nerve is damaged, this is known as optic neuropathy or glaucoma. It is not a cataract. A cataract occurs when the normally clear lenses of the eye becomes opaque, leading to blurred or dim vision. In option C, pressure within the eye is a characteristic of glaucoma and not a cataract. While in option D, cataract usually causes gradual vision changes, but pain is not typical. So our answer is option B. Question 24. The blockage of the blood supply to a portion of the brain causes A. Dizzy spell, B. Stroke, C. Blackouts, D. Heart attack. A dizzy spell is a temporary feeling of lightheadedness. However, this is not caused by a blood blockage to the brain. A stroke occurs when the blood supply to part of the brain is blocked or reduced, thereby depriving the brain tissue of oxygen and nutrients. It can be caused by blood clots or bleeding in the brain. A blackout is a temporary loss of consciousness, and this can have many causes, but it is not specifically due to a blocked brain's blood supply. A heart attack occurs when blood flow to the heart muscle is blocked, but this is not for the brain, so that's not the correct answer. Our answer here is option B, a stroke. This occurs when the blood supply to part of the brain is blocked or reduced, thereby depriving the brain tissue of oxygen and nutrients. When it is caused by a blood clot, it is known as an ischemic stroke. And when it is caused by bleeding in the brain, it is known as hemorrhagic stroke. Question 25. Why is age a factor in safety? A. Young children have not learned what is safe and what is dangerous. B. Infants are helpless. C. Physical changes from aging can affect balance and movements. D. All of the above. Children are naturally curious and lack experience, so they may put themselves in unsafe situations. Also, infants cannot protect themselves, and this makes them more vulnerable to injury. Older adults may experience reduced strength, slower reflexes, impaired vision or hearing, and this increases their risks of accidents. So, for this question, our answer is option D. All the options are factors in safety because safety risks are influenced by age at both ends of life. So, from infancy to elderliness. So our answer is option D. This brings us to the end of the practice questions and answers for the NACC PSW video. Don't forget to like, comment, and share, and also hit the subscribe button so that you'll be informed when our next informative video will be dropping. Thank you for watching, and I'll see you in the next video.